I'm going to be talking about. Okay, okay, okay. I'm with you. All right. So I'm going to be talking about one of our studies that we did titled "Factors Affecting the Uptake of Modern Contraception Services Among Women of Reproductive Health in Nigeria." Now, I'm going to just talk briefly about the background. Nigeria is the most populous country in sub-Saharan Africa, with the current estimate of 180 million people. Now, in recent decades in Nigeria, fertility has declined only slightly from a total fertility rate of 6.3 births per woman in between 1981 and 82 to 6 to 49, that is by the WHO. Yes, we're using a modern contraceptive method compared with 8.2% in 2003 and 9.7 in 2008. Now, in Nigeria, having a large family is Nigeria. Now, let me just add that Nigeria is yet to experience demographic transition observed in many. Okay, okay, I'm with you. I can hear you. Okay, 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 okay. Thank you very much. Okay, okay. What I was saying is that Nigeria is the most populous country in sub-Saharan Africa with the current estimate of one. Okay, okay, okay. Thank you very much. Oh, okay, okay, very good. All right, all right, all right. So, as I was saying the other time, in Nigeria, having a large family is highly valued, thus increasing the acceptance of modern contraception, space of birth limits. That is by measured learning and evaluation into 2010. Now, approximately 42% of the country's population is under the age of 15 years. That is, we are having quite a lot of this age category, and 55% are between the ages of 15 and 49. And as specified by the WHO, 15 and 49 is the category of women of reproductive age. And then Nigeria's young age distribution is due to, in part, to its high fertility, as the average number of children born to a woman in Nigeria is 5.7%. 5.7. Then now, contraception has proven to be an effective way of controlling fertility and spacing birth in Nigeria. For example, we have quite a number of people in Nigeria. Now, studies have shown that contraception can avert high-risk pregnancies and consequently reduce maternal death. Now, it's right there in the in so several studies that people have done, that by the time you start using contraceptions, you can reduce high risk pregnancies, and then reduce maternal death, and also reduce the population. And then uptake of modern contraception is promoted as a mechanism to address the reproductive health needs of men and women, as well as the crucial challenge of rapid population increase. Now, I just want to show you this reproductive health choices and pregnancy desires. Now, we have different kind of people. Some people want pregnancy now. Some people want to avoid pregnancy now. Then some people still prefer safer contraception, counseling, and services to reduce own HIV risk or risk of transmitting to partner. And then also, while those people that want a pregnancy now, they have choice of effective reversible contraception that does not interact with HIV treatment or increase HIV risk. Now, all this comes to supported for desired family building. Talked about family planning. Now, for this study, the conception framework that was adopted for the uptake of modern contraception services can be seen. Now, this source is from the Center for Reproductive Rights and Women Advocates. You can see that from demand, when you raise the demand, it comes to supply. Then when there's a demand, there must be a supply. And then, of course, we have the demand creation. When you are doing the demand creation, you have to ensure that the logistic management system is in place, policies are favorable, human and organizational capacity, resource and financial and resource mobilization is in place as well. Then from demand creation goes to demand for reproductive health services. And what are the services? Reproductive health commodity security, ensuring that they are in place. That is, for us to have a successful reproductive health services in the country, we need to have commodity security, and then commodity, and which will produce reproductive health outcomes, and then also increase demand so that there can be service utilizations at those facilities. Now, our method is a cross-sectional descriptive study using a two-stage systematic sampling technique, which was used to select 530 women of reproductive age, that is between 14 to 49, in 5 wards using sample size based on proportion to size in 20,000 households. We actually did this in 20,000 households to select 530 women of reproductive age. Now, respondents were interviewed using a semi-structured questionnaire, which include questions on social demographic characteristics. We asked them questions about their awareness of family planning. We asked them, we tested their knowledge, factors affecting the usage of modern contraceptions, and perceptions of contraceptive use. Then we scored our knowledge. Our knowledge was assessed on a 5-point scale, in which score of less than 2 were rated poor, while perception was scored on a 36-point scale, in which scores above 18 were rated low. Then data were analyzed using descriptive statistics. Chi-square test, logistic regression were used at the p-value of 0.05. Now, quickly to our results. Age of respondents was 30.3 plus or minus 7.8 years, and then 73% were married. Now, most of our respondents, the majority of them were married, and 60% of were Muslim, and 34% had secondary education. Now, those are the characteristics of our respondents. Then 72% of the respondents were self-employed. Then about 90% had good knowledge of contraception, while 60.8% had ever used contraceptives. So among our respondents, we had quite a lot of them that had good knowledge, good background of what contraception is, and then just 60% had used contraception. Now, when we say use contraception, condom is part of it, and then implants, implant-on, IUD, and different methods as well that I'm going to be talking about. Now, the awareness of family planning. Now, when we asked, have you heard about contraception? We had about 516 out of 5,000. That's giving us 97.4%. Then awareness of family planning, 406% said they were aware. And then we wanted to know where the family planning if they were taught in their primary, secondary, and tertiary. And then at primary level, they said 15% responded that 15 people responded that they were actually taught. And then in secondary level, 151% were taught. And then at tertiary, 90 of the 90 persons, 90 participants said that they were taught about family planning at the tertiary level, that is university level. Then one of the results is that the common source of information about contraception was mass media. That is, in Nigeria, they said a lot of jingles, awareness, sensitization about family planning. Then 62% obtained husband approval. That is, before they use contraception, they obtain their husband. Just quite a few of them obtain husband's approval before it is used, because here in Nigeria, because of cultural values, you have to take permission. So while some of them said that they have used modern contraception before first birth, some of them have been using condoms, some of them have been using IUD, some of them have been using implants. Then 50% of the respondents agreed that contraception helps in improving standard of living, and 67% had good perception about contraception. Now, when we talk about knowledge and modern contraception, yeah, I'm with you. Okay, 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 okay. Let me just take it. Okay, so now back to the main results. Factors affecting the usage of contraception. This is very, very interesting. Reasons for it. Some of them requested for abortion because they said because their pregnancy were not planned, and then some people requested for abortion because complication during pregnancy, too young to have first child, and then I think the highest was pregnancy was not planned. That is unplanned pregnancy. That is tending towards people taking utilizing the services of family planning, modern contraception in various facilities. Then now, one of the factors that hinder effective uptake of contraception services include poor provider attitude. most of them said, okay, they couldn't take up modern contraception is because when they get to the facility, the service providers, tell them so many things, don't attend to them, abuse them and all that. And then congestion at service centers. There are quite a lot of people, not only on reproductive, on modern contraception enough alone, but some of them came from minor illnesses and all that. So that is why we are having congestion at those facilities. So about 4.5% said they couldn't take it because there are congestion at those service centers. Then responded with non-use of contraception before force birth were less likely to subsequently use contraception. We have the odd ratio of which is very, very significant. Then we asked them, what stops you from getting modern contraception? They said long distance. Well, majority said myth and misconception that, okay, if they use contraception, they won't be able to have children anymore. Their fertility rate will be lowered and all that. And then we had the highest. The second one is because of the service provider attitude, and then also societal norms and prejudice. Some of them believe that it is not in their religion to use it, and then some have long distance to facilities where they can access such services, so they couldn't take it. Now, because of the time, let me go to this as well. Now, majority of women were knowledgeable and aware of modern contraception, but husband's approval to use of modern contraception remains poor. That is, getting husband approval is very, very poor to use contraception. Now, preferences for sort of modern contraception, some of them take it at the health center, and then some prefer general practitioner, and then patient medicine store as well.